So I'm going to perform female indwelling catheter. I would knock on my patient's door, I would check the order, I would introduce myself to her or just remind her of my name. I would identify my patient using two identifiers to make sure that she is the right patient that's supposed to get the catheter. Ask her if she's allergic to anything, check the order to make sure she's not allergic to anything, and explain to her what we're going to be doing. The first thing I'm going to do is perform hand hygiene. And then I'm going to put clean gloves on. I'm going to raise her head of the bed up. So that it's in a comfortable working position for me. I'll put her head down. And I'm going to put the side rail down. Putting on my gloves. And we're going to do a little abdominal assessment. She is a little distended. She's got a little retention, so we're going to insert the catheter for that reason. I would not palpate due to any uncomfortableness. So I have my tub of water here. I'm going to get her all cleaned up. I'm going to roll the blankets down, trying to provide as much privacy as possible. I closed the drape and the door. Unfortunately, it's not an easy way to keep her completely covered. So I would put her legs out a little bit to make a little bit more room. Wrap my hand up, dip it in the warm water, go from top to bottom. Clean one side of the labia, turn this around, do the other side, and then a third time, from top to bottom down the middle. And then I would dry her off. The next thing I would do is put her chucks down, which I should have done before I bathed her, to make sure that there's no her bed doesn't get wet. I'm going to put that one down. And now I'm going to set up my sterile field and put my sterile gloves on. So I take off these clean gloves, I throw those away, perform hand hygiene, and I proceed to set up my sterile field. I get my equipment, make sure that this has everything in it that I need. Check the expiration date, open it up, and then pull this out. This bag then becomes my garbage can for ease. And I'm going to put this by her feet. I'm going to open this up. This one I'm going to lay down and now I'm going to put my sterile gloves on. I don't need that anymore. And I'm going to move this back over. So in the top of my kit, I have saline, I have iodine, cotton balls, and lubricant. So first thing I'm going to do is take out the iodine, and I'm going to take the cotton balls and separate them so that I'll be able to use them a little bit easier. I'm going to open up the iodine. I'm going to pour the iodine all over the cotton balls to get them very saturated, and then that gets thrown away. Next thing I'm going to do is I'm going to put lube in this tube here, and then I can throw that away. And then I'm going to take out my catheter, and I'm going to place it in the lubricant. And then I'm going to put this back on here to the best of my ability. And I'm going to take this, holding the catheter in place, and put this down here. Spreading out my sterile field, moving this over, and then I'm going to put this down here. Trying to keep the catheter and the lubricant. Okay, so the first thing I'm going to do, I'm going to tell the patient, you're going to feel a little cold. This is the iodine. Taking it and saturating one side, throwing it away. Taking another one, cleaning the other side, throwing it away, and then taking one last one and going right down the center and throwing that one away. I can now throw away my tweezers as well. I'm going to take my saline and I'm going to attach it to my tube. We don't test this one, but that way hopefully it'll be a little bit easier to use. So now my catheter is got lubricant on it for 1 to 2 inches. Oops, that didn't work out. With my non-dominant hand, I'm going to spread the labia, holding the catheter, telling the patient to take a deep breath, and insert it into the urethra. I'm going to go about 2 to 3 inches. I'm going to see if I get urine return. If I do, I'm going to go another 1.5 inches, 2 inches, and then I'm going to inflate the balloon. Using all of the normal saline that's in here. It's a 10 cc balloon, and there's 10 cc's in my catheter. Next thing I'm going to do is take the bag out. First I'm going to tug gently, make sure it's in place. I'm going to take the bag out, drape it over her leg, make sure there are no kinks and everything is flowing well. Hang it on the hooks that are underneath the bed. If I have a stat lock, I would attach this so she's got some pull, but it'll stay in place. And then I would proceed to clean up. Taking this, getting all this out of the way, throwing that away, and then I would clean her up. Take my washcloth, dip it in the warm water. Again, this is to remove all the excess iodine. Flipping that around, going down the other side, and then one last time. Right down the center. Want to make sure that she's not uncomfortable, and then we would dry her off. Okay, take my garbage, put that over here. I would then take off my sterile gloves, throw those away, clean this up, ask if she's in any pain, if she's having any discomfort in any way. If she says she's fine, I will help her get back into position on the bed. I will cover her back up. I would then lower the bed, putting the side rail up. Raise her head a little bit so she's a little bit more comfortable. Ask her if she needs anything. Make sure that her call light is in reach. Tell her I'll be back shortly to check on her. I would perform hand hygiene on my way out, and I could then go document what we just did.